Good evening from Manila. Again, it's 6 p.m. and welcome to the 8th and final session of our Southeast Asia Climate and Health Responder course brought to you by the Global Consortium on Climate and Health Education based at the Columbia University's Mailman School of Public Health, the St. Luke's Medical Center College of Medicine's Planetary and Global Health Program, and Healthcare Without Harm, Southeast Asia. Again, I'm Dr. Renzo Ginto, the director of the Planetary and Global Health Program at St. Luke's, and I will be this session's moderator. Again, welcome to the 8th session, and I'm already seeing some comments. I don't want to be this last session. Well, perhaps this is just the beginning of your journey in climate and health. So today's session will follow a slightly different format. You will not be hearing a lecture, unlike during the first 7 sessions. Instead, we will have a panel discussion, an interactive conversation between climate and health leaders from the different countries of Southeast Asia. We will be hearing from different health professionals on what they're working on, what are the barriers, the challenges, as well as the opportunities that they encounter in leading and advocating for climate and health in their respective countries and in the rest of the region. So now let me introduce to you our panel. We have 4 panelists today, and we're still waiting for our 4th panelist, but let me introduce them now. We have Dr. Minerva Kalimag, who is the president of the Philippine Medical Association, of course, from here in the Philippines. Dr. Wiwat Chatwongwan, who is the deputy director of the Maharat Nakhon Ratchasima Hospital in Thailand. Ms. Gladys Wong, our senior principal dietitian from the Khu Tek Puat Hospital in Singapore. And Ms. To Thia Lien, the coordinator of the Center for Health, Environment, Research, and Development from Vietnam. So these are our 4 panelists. And what will happen is I'll be asking them questions first, followed by a Q&A session where all of you will be given a chance to ask your respective questions to our panelists. And then remember, in the previous sessions, during the last 30 minutes, usually we have a case study, whether it's a clinical or a public health case. But this time, we will end not only this session, but this entire course with an open forum where all of you will have a chance to share your thoughts and to express your commitments for climate and health. So now let's begin our conversation. And again, thank you very much, Dr. Kalimag, Dr. Chatwongwan, Ms. Wong, and Ms. To Thia Lien for this opportunity that we can all share our experiences and our insights. Maybe we can remove our slide so we can put a spotlight on all our speakers. Okay. And my first question is very simple. To all our panelists, how did you start in your climate and health leadership and advocacy? Can you tell us briefly about your story? And I understand that some of you have some prepared slides or photos, so this is your chance to share a bit of who you are, what you're doing, and what you're working on in climate and health. Maybe let's begin with Dr. Kalimag, joining us from the Philippines.
Hello. So this is Dr. Kalimag from the Philippine Medical Association as president. I actually started off my journey in leadership 20 years ago, and even before that, no, because started at the Manila Medical Society right after graduation. That is, and taking the oath, no. So that will be around 1983. But then when I became the centennial president of the Manila Medical Society, I started off with solid waste management. That's how I started. And then So the advocacy, we have 21 hospitals in Manila at the time. And so we go around doing the lectures and doing the how to do solid waste management. And then when I became president of the Philippine Society of Anesthesiologists, I went on to actually advocate for clean air. Because remember, we are using, as anesthesiologists, we are using uh, vapors and gases, no, to put people to sleep. And all of these gases are actually in the environment, and their carbon footprint actually impacts also the environment. So I started to advocate for regional anesthesia. So when I became president of the Asian and Oceanic Society of Regional Anesthesia and Pain Medicine in 2015 to 2017, I also started the Regional Anesthesia Society of the Philippines. So, so to move out of gases, no? And then, of course, when PMA came, I started off greening PMA. We shifted all our lights to LED lights. And actually, our electrical consumption drastically dropped, almost 50–60%. And then now we will be moving towards solar power here at the PMA building, PMA admin building. And then when we go to, for example, the Masian, now because the Philippine Medical Association is part of the Medical Association of Southeast Asian Nation and the Confederation of Medical Association of uh, Asia and Oceania. And then we have this what do you call this, food security, because climate affects food security. We also note that, of course, changes in climate uh, causes upticks, for example, in vectors, no, of diseases. So all of these are all uh, tied together. Then, of course, Renzo, I met Renzo in 2014, and we've been together in many advocacies. And then we have this also, let me show just photos. Okay, so just, okay, so this is a road sharing project that we also did for PMA together with other advocates, Dr. Antonio Dans, no, of UPPGH. So we have this road sharing so as to diminish uh, engine exhausts, no, and then of course promote wellness because of exercise. We join Earth Day celebrations, and then this is what I was saying back in 2002. So we have this MMS online. So we have this solid waste management. I spoke at the Rotary Club. We are now part of, we have established Healing Hands Club for Rotary, and this will all be about health. So this is, I spoke on conservation and Mother Nature, conversations in health. And then this is at the University of Santo Tomas, when I had the opportunity to do the academic lecture for the entire university. I spoke on research on the social agenda, the tale of two rivers, of dead rivers and the river of life. So this one, okay, this is the about food security. And then Renzo there with the renewable sources of energy. And remember the Paris Accord, which we had, okay. And then of course, against vaping, anti-smoking, Clean Air Act, together also with the Protecting Nature to Preserve Health at the Philippine Society for the Study of Nature. And then we went to Congress. Remember, Renz? So it's all day 589 of my term at the PMA. That's the last slide. So many things.
Yep, and that's day 589, and now you're on your day
I'm
thousands,
now,
right?
yeah, I'm Yes, thousands already because I have 731 then, another 365, and on my uh, 29th day of my fourth term.
Thank you so much, ma'am, for sharing a bit of your story. Started from your involvement in environmental advocacy more than 20 years ago, all the way to in the field of anesthesiology, and then more recently in the Philippine Medical Association. We will be asking more questions later on. But for now, let's listen to Lien, who's joining us from Vietnam. Lien is a public health professional from Vietnam. So please share with us your story. Lien, you're muted.
Sorry. Good morning, good afternoon, and good evening, everyone. I'm Lien from the Center for Health Environment Research and Development. I'm now working as the program coordinator for the Green and Healthy Hospital in the Gerard Center. Well, about our story, thank Rangel and the panel for the very thoughtful question. More than 10 years ago, in the council defending the graduation thesis, measuring in environmental health of the Hanoi School of Public Health that I graduated from. Based on the research finding that I presented in that panel, a member of the panel, Professor Huy Nga, he is a former leader of the Ministry of Health in Vietnam, and he now is my boss and the director of the JERAS. He asked me in the panel a question, and that led me to the discussion. Are you ready to take action to address the challenges that our country's health sector has been facing related to the climate change? So that question led me to this question, to this discussion today. And from that moment until now, I and my team already support Ministry of Health of Vietnam in several issues. We have the Ministry of Health in developing the National Action Plan on the climate change resilience in Vietnam health sector in 2019 until to 2030 and a vision to 2050. And after that, I support the focal agency of the Ministry of Health to develop the training materials in climate change and human health for policymakers, health managers, and staff. And this document already been applied nationwide. And that's some our contribution for that. You can find the references you will share in the section 7 related to the project funded by ADB that strengthen resilience of the climate change in the health sector in the Great Mekong sub-region. Okay. And now my organization is supporting the Ministry of Health in Vietnam to promoting the movement in green, clean, and beautiful hospitals. And that's why I work with the Healthcare Without Harm, and I come to this meeting today. And I'm now quite proud to be the consultant to support the Ministry of Health to include the climate change and human health regulation in the disease prevention law. And hopefully that we can pass the law next 2 years. So that's a big movement of Vietnam government to in the climate change and human health. That's my story I really want to share. Thank you very much.
Thank you so much, Lien. Wow, impressive developments that are happening in the Vietnamese health sector. And I'm glad to hear that you are very much a part of it. But also, I think one thing that we can learn from you is it always starts with a question, right? A challenge, someone asking us to take on a challenge, to embrace it, and to do something about it. And so I would like to urge our co-learners, we now have around 290 plus in Zoom, to share with us in the chat box, when was that time when you were, when your eyes were open to the climate and health crisis? When was the time when you were asked that question, what are you going to do to not just only heal our human patients, but also our planetary patient, Mother Earth? We would love to hear your stories in the chat box. And while you're doing that, may I now call on Gladys Wong, joining us from Singapore, a dietitian nutritionist who's also leading in climate and health advocacy in her hospital and in her country. So Gladys, now this is your turn. I'll give you the microphone to you.
Yes, but I cannot find the page on my, can someone else go first? Because I can't find the Zoom page on my Zoom. Is there someone else that can go first? I can't.
Well, actually,
oh yeah, no, found it.
You found it.
Already.
Okay, good.
Yes, okay. So I'll share the slides now. Who can share? All participants? It's not letting me share.
Can we make sure that Gladys is a co-host? Oh, you are a co-host, so you should be able to share.
Host only all who can share? All participants. Host only all participants. I click the share screen. It has nothing coming up.
Okay.
There's nothing coming up on the screen.
Yeah, if you have a link, you can kindly share it in the chat box and we'll help you.
A link. It's actually on my hard drive.
Okay. Okay.
Sorry
because our fourth panelist is still on his way, so it's really your turn now. But if you can give your file to one of the members of our team, maybe Jit, then we can help you.
Okay, Jit, I will just email the slides to Jit.
Okay. So maybe while we're waiting for Gladys, well, we've learned from Dr. Kalimag her story, and Lien her how would I say it, waking up story as well, and now she's very much involved. So my question is, what are some of the challenges or barriers that you are facing in this advocacy of climate and health? Are you experiencing some pushbacks or some resistance? Maybe you can give some stories or anecdotes on how you were able to overcome this resistance, if any. Dr. Kalimag, do you want to start?
Well, not really. As soon as we start educating people, they see the wisdom in what is really, and everybody can feel, you know, with all of these calamities going on. I think all we have to do is connect the all of these disasters and things that are going on with the climate change that is actually dawning on us. So all you have to do is really educate, increase their awareness in order to start them off. Actually, I am also a member of a board of directors of the Philippine College of Hospital Administrators, and there our whole summit for this year is on greening the hospitals. Actually, also, so it's really when you talk about leading, it's actually taking on all the initiatives and then cover all grounds. Try to, you know, influence, be an influencer. I think that's the thing.
Thank you, ma'am. Lian, do you have any thoughts on the question regarding challenges or resistance to climate and health?
Well, and I just introduced that now we are supporting the Ministry of Health in green and beauty hospitals, and we have some initiative related to that program. One of the initiative is the develop a circular economy model in plastic waste management in the healthcare facilities. And what we are, the challenge we are facing now is how to gather and facilitate and support all the different stakeholder group to work together. I think it's very important in CCNSH because it's not the responsibility of a stakeholder, not the responsibility of only government or communities or health profession or any types of group. It's the responsibility of all people. So how to inspire and how to gather all stakeholders to work together to achieve the common goals. So that the challenge that all project, if you want to be success and sustainable, you have to involve all kinds of stakeholders, and we have to facilitate and support them to work together. And we now have some difficult to try to get the close intersectoral coordination among local management agencies like Department of Health, Department of Environment, and Environmental Police. If they can work together and understand the same message, so the work will successful. But now we have some trouble because of the awareness of some stakeholders is not good enough in this issue. So one of the challenge I think we have to face when we work on the climate crisis, that we have to raise the awareness of the stakeholders so that when they understand well about how the relevant between the climate change and the human health and their activities and their work, so they will join us. And another thing is that engage the private sector, because I think it's the same in other developing countries, that the resource of the government will reduce. So when we include the private sector to help us, so we will have more resources and the activity will sustainable. So that's one of other challenge we have to face and we have to deal with. And what we learned from our activity now is we try to involve them in the very beginning phase of the project and share the information with them. So we try to have them to sit together and define the common agendas to work with. So I think it's a lesson learned from our project implementing in Vietnam.
Thank you very much. And thanks for emphasizing, both of you, the importance of raising awareness, education. And usually people also become awakened to the importance of an issue when they themselves experience the negative health consequences of, let's say, a climate-related event like a typhoon or a flooding. I would just like to read some of the answers in the chat box. One of them said that the first time she or he became aware or became compelled to act on the climate was when there was Nargis, when there was a cyclone, the Nargis cyclone in Myanmar in 2008. Another one said winter of 2018, when there was very poor air quality in Delhi. And then Filipino said Yolanda, Typhoon Haiyan, which hit the Philippines in 2013. She was a volunteer and she saw the devastation that happened there firsthand. So even the health professionals themselves have been witnessing, all these different impacts of climate change. Okay, so I'll pause there because I think Gladys' slides are now working. I wonder if we can bring back Gladys again, and we can put the spotlight on her as well. And can we make her a co-host as well, Raisa? Thank you.
So you can see my slides now?
Yes, we can see it now. And we wonder if we can see you as well.
Yes, I can see it too.
Hmm.
So I just got to make sure. Okay, right. Shall I start with it quickly?
Sure.
Okay, so apologize to everybody because I think I clicked something and the thing wouldn't zoom off. Okay, so I'm Gladys, a senior principal dietitian from Khoo Teck Puat Hospital, which is under Yishun Health, which is under National Healthcare Group. And I noticed my spelling is wrong, but never mind, in Singapore. Okay, so I think what we are talking today is about leadership and advocacy. So sharing just a little bit more is to say that really, I think the hospital has to have very good supportive senior management. Okay, and where it is, we have a philosophy in our hospital where we think big, dig deep, start small, and we act fast. It's always been happening for the past 20 years. I've worked in this organization for 23 years already. So when it since we were at Alexandra Hospital first before we moved to build the new Khoo Teck Puat Hospital, we were already talking about health. Okay, and we have these 5 pillars of health that we're all looked at, and we even publish books on it, so you can go onto that QR code if you want to get the e-copy of it. We also joined the International Health Promoting Hospital as well. But at that stage, where I come in, I was a chief dietitian for 17 years. Then I stepped down in 2019 to become senior principal dietitian, but I was chief. I was running the department at that time. So remember at that time, we are talking about promoting health, right? Promoting health, and because we have a lot of green land at that Alexandra Hospital, it was talking about green environment, mainly for healing and wellness. There was nothing about green at all. There was nothing about sustainability. But if you move towards that direction, more these days, right? Then you're talking about promoting environmental sustainability to help to save the earth. We had struggles. We had struggles getting people to eat less food, to eat less meat because it's costly, you know, because it's cholesterol and all that. But now, because of this environmental sustainability, it made my life much easier as a dietitian to promote health as well as bring in about saving the earth as well. Okay, so with that aspect, we had this pillar underneath that says environmental impact to go green. Okay, to go greener. So, but the thing is, with all our medical profession, the question that they all will ask is, we are a hospital taking care of patients. Why spend time on such non-patient related matters? I'm sure you have got colleagues that say the same thing and ask the same thing all the time, especially doctors. Okay, so what do we do then? Oops. Okay, so our hospital has got this philosophy as well, where we follow this book called Change or Die, the 3 keys to change at work and in life. And so what we try to have that model of relating. We try to reframe the story again, and we try to keep repeating it until people realize that it is something that is the norm and they should just give up and follow through. So we do have different ways of cajoling and sort of a sort of nudge, okay, to nudge different colleagues and different staff to go green in a lot of ways. A lot of the time also, when you come to the green environment, although we have senior management support, right, it is really, ideally it's bottoms up approach rather than top down approach. So we have a group of green volunteers that's helping out. We don't have a sustainability officer in our hospital yet. Okay, the workload is maybe not justifiable, but other hospitals has got this sustainability officer, but our hospital hasn't got it yet. What we have volunteers. Our engineer head, our facilities director is the chair of the Green and Sustainability Committee. So we have green volunteers. We also have supportive senior management that goes through the whole thing together. Oh, the photo has moved. Okay, so we also have all these goals that we build on building sustainability towards waste reduction, as well as staff and community engagement, which is our 3-year roadmap. And this is volunteer, it's volunteer work. It's not part of our KPI per se. So it's really taking our time as well. So we're talking about seeking sustainability in our hospital. We even produce a book as well. Okay, seeking sustainability. You can QR code to get the soft copy. It is really, when we built the Alexandra Hospital to Khoo Teck Puat Hospital, we have all the outskirts, the hardware talking about architecture, landscaping, you know, those placemaking and green cultural buildings. We have that in place. So that becomes another turn again that we have to move back to our people, to move the people again to judge them. So how does a dietitian get involved in green and sustainability matters? but because every time I write down, and the thing is, I got to say, this organization, when I registered for this workshop that time, this course, you didn't have dietitian as one of the drop boxes. I got to put it down as others. So how does the dietitian get involved then? You see, but because of food, you see, with the 10 agendas of the GGHH, food is one of the areas. I mean, food makes the whole world goes round, isn't it? It's not really money, it's really food. Hey, food is the ingredient that binds us together, especially in a hospital setting. So as a dietitian, at that time I was a chief dietitian as well, there was a lot of things that we can do with the kitchen, because it is an area that, talking about utilities as well, talking about disposables, there is a lot of carbon footprint. So that is that part. Now I didn't share, maybe I'll share later about what are the things that we have done in the hospital to reduce the carbon footprint. But look at Singapore as a totality. We have 3 clusters. Okay, so we have 3 clusters, was 6 formed to 3 since 2018. We were under the National Healthcare Group. The strategy that we have to move people at a higher level out of the hospital is a long-term process. You look at this now, or the 3 hospitals, Yishun Health, which I'm in, Khoo Teck Puat Hospital, but we belong to this whole 1/3 of Singapore cluster, which is called National Healthcare Group. And the Yishun Health is one of the groups inside the cluster. A bit confusing, but what happens is there's 3 of us first, all right? Then on top of that, we managed to, over the past 2-3 years, got Institute of Mental Health, okay, Institute of Mental Health as well as Tan Tock Seng, which is the same cluster, to join in with the Global Green and Healthy Hospital as a member. They have joined in, it's not so much, hopefully it's because we nudged them a little bit as well, and it's a sort of like, you know who you know, that kind of thing. But it is also a lot at the national level. So at the Singapore level, there was a lot of sustainability issues. They have to do a lot of reporting as well. And so somehow that has got that GGHH has got the added edge of saying what is attractive to these hospitals, that they can learn from best practices. So what I want to clear is with this, hopefully a take-home message is, being members of GGHH, right? Not a GGH member doesn't mean that they have no action and not practicing green. The whole Singapore, a lot of the hospitals are practicing green. They're just not members yet. So even if they're not member now, doesn't mean they're not forever. So I'll keep trying, we'll keep trying and nudge the other clusters to get in, because now our main cluster, National Healthcare Group, has got the 3 big companies, the big hospitals that's already GGHH. Hopefully at a national level, the other 2 clusters will say, hey, maybe there are some goodness in it, and let's join in as well. That's the long run. Okay, that's all. Thank you.
Thank you very much, Gladys, for sharing your story and the story of your institution. I don't know if you can turn on your camera at the moment so we can have a seamless discussion.
I could. Oh, was my camera not turned on?
Yeah.
Oh, all this while, and there I'm smiling at you the whole time.
Oh, we missed your smile. I don't know if there's a way to resolve that.
Okay, there you go.
Okay, now we can see you.
I forgot. I'm so sorry. Yeah, you can see my face now.
We can see you now. And maybe as a follow-up question, and by the way, thanks for highlighting the importance of recognizing all the health professions, including the dietitians. I think one of our goals should be to make sure that, the whole healthcare sector veers away from a more doctor-centric model. Sorry, Dr. Kalimag, but I think you are an ally in this vision as well, to making sure that all health professionals are seen as equals. I honestly don't like the term allied health professionals, because they're not just our allies, they're fellow health professionals who are vital for the provision of holistic healthcare to our people. And that includes our dietitians, who are oftentimes under-recognized. So thank you so much, Gladys, for all your efforts, and all to the dietitians, nutritionists in the room. And if you are one of them, please introduce yourself in the chat box. My question to you, Gladys, is a while ago, you might have overheard, we were talking about resistance, barriers, challenges. Did you encounter any major barrier or challenge when you were trying to create those structures within your hospital in order to implement all these green initiatives, including or especially around food?
Around food, definitely, because our food services is really look at patient connection as well. Patient feedback forms. You have to really engage the chefs to be able to look at cost, because going more plant-based or changing the recipes, we do have many other challenges as well. And even if I wish that I can induction the whole kitchen with all the woks and take off all the gas, it is still not possible. So what I do is I get student projects. We get university dietetic students to do projects, to do the documentation. And so there are certain things that they do and they make a report of it. And so that facilitates it easier for the chefs as well as the food service department to be more convinced to actually do the job. Some of them are convinced to do it, but it's just that to get it happening, everybody is so busy and there is just a manpower crunch as well. This is extra work. It is really extra work. So unless there's a documentation that shows that there's a cost saving and there is a need to actually do it from a productivity perspective as well, then things may move a bit faster. But there were a lot of challenges, but things has progressed for many years, because I remembered in 20 years ago when I wanted to introduce plant-based diet in the kitchen, I was having a holiday in Korea and my boss called me and said the chef went to complain to her what I was talking about, getting a meatless Monday. I said, well, it's only one day a week, but at that time, meatless Monday was really unheard of, really at that time. Yeah, so we have gone a long way to even have a meatless Monday in our hospital. We just had a public forum last weekend on Sunday looking at plant forward, because whole food plant-based is just impossible at the moment because of Asian diet. So processed food is also agriculture. We're not agricultural country, so we are coining it plant forward, age forward health. So we are using the word forward. My trendy word at the moment is forward. So it's plant forward. So it's actually cutting down on meat. It sounds more able.
Doable.
That the chefs are, yes, doable and more digestible for a lot of people.
Thank you so much, Gladys, for those tips, especially for those in the audience who are also now starting to think about introducing plant-forward diets in the respective healthcare organizations. So I've been hearing some already about about the challenges, the barriers. You even mentioned, Gladys, that people probably just do not have enough bandwidth to do these kinds of things, right? But it's important also that we're able to show the benefits and even the monetary benefits of implementing such changes, reforms in the healthcare sector. Perhaps you can also speak about what are the drivers of success for the different activities, innovations that you have instituted, for example, for Lien at the ministry level, for Dr. Kalimag at the level of the Philippine Medical Association, for Ms. Gladys at the hospital level. I know, Dr. Kalimag, you raised your hand before my question, so you can also jump in and tell us what you have in mind.
So actually, we remove barriers through a paradigm shift into what we call transdisciplinarity. So we do not limit the conversation to just health and allied health. Because, for example, built environments, we can talk with architects, engineers, right? And then, of course, with Gladys, we can push forward for culinary medicine in the curriculum, right? So these are things that we can also do, think outside the box, things that we do not put barriers to our thinking. It's all about really just go ahead and do what you have to do.
Thank you, ma'am.
Yeah.
And in fact, one of the participants in the chat box was sharing her experience regarding biking and urban mobility, and how that issue opened their eyes to the connection between human health and the environment. And fixing roads and designing cities, that's something we cannot do inside the clinic or the hospital. We need to
Yes.
collaborate with the other disciplines and sectors. So thanks, Dr. Kalima. Gladys, please.
Yeah, I think that there was it's just because I've been around for a long time that we have done a lot of things, and a lot of things that we've done, it seems not much to brag about because it's become a norm in the organization. So yeah, which is a good thing as well, because when people sort of say oh, we have done well at Cote d'Ivoire, I say, well, it's a norm for a lot of us already. It's more of the new people, as well as talking about the bigger stones. So we have engineers who are very supportive, and we need them as well, because I'm not an engineer. And so you're talking about the carbon calculator, to use that to actually do any documentation at the national level. They have already started to do annual submission of your utilities. So your utilities in the hospital is already in terms of electricity, the air conditioning, as well as your gas. But you're talking about other things like using single-use straws, using paper plates and disposables, bring your own cup. Those are the things that we have done a lot of initiatives, and quite a few we are quite proud of, but we try not to brag about it. It's because human beings has got this mentality. If you tell them that your product is low in salt, they will say that it's not nice, isn't it? If you keep quiet about it, life just goes on, and the carbon footprint is less. So there are certain things that we just we report in scientific papers, but we just don't make too much noise about it. But we would love to share whatever there is. But I think very, very big chunk of it, talking about food is only a small chunk, but the kitchen utilities is really the electricity, as well as the gas and the air conditioning in the hospital. I mean, if we can really work on those big ones, all the small little things really works through the internalization of the staff. Yeah, you know what I mean? I think it is very important. We must look at the big picture first, which is your engineers playing that big role, and also at the theater, at the how you're looking at waste disposal. So at a national level, we're talking about procurement. There is already top-down KPIs that has to be put through all the hospitals under Ministry of Health, looking at procurement and how we will have to work with companies and set the right specifications for procurement. Yeah, and it's not even coming to this, to looking at recycling. I think it should actually be in the first place, prevent and refuse in the first place before we look at recycling.
Thank you so much. Important reminders indeed, because when you look at recycling and disposal, that's already too late, right? We need to focus on the source, how to reduce our consumption. And I also like your point a while ago about how can we make this not anymore a surprising or something spectacular, because it's part of the norm. And I remember one environmental activist teaching me before that our goal should be to make the term environmental advocate obsolete, because that just becomes part of our DNA. That
Exactly.
and
Yes.
same thing for health advocate. Health and environment, they're all part of our DNA. And so it's not anymore surprising to meet someone who's a health and environment advocate, because everybody is doing that. So thanks, Gladys. Lian, do you want to add anything about drivers
Actually,
or enablers?
I just want to add one point related to the Madame Gladys. When we think about the circular economy of the waste, let's think about the EPR. That means the extended producer responsibilities. that's a new policy that Vietnam government now try to create the mechanism for all the producer have responsibility with their products. So when because Madam said that we open the mind, think outside the box, so let's think about the producer from the private sectors. So that's one thing I want to share.
Thank you, Lien. And you know, the good news is that the Philippines just passed its extended producer responsibility law, I think a few months ago. And this is another area where Southeast Asian countries can actually collaborate on, right? Learning from each other's experiences. We learn from Singapore's food system innovations, or you know, the Philippines laws, or Vietnam's efforts in building low carbon and climate resilient healthcare. So, you know, building this community, this regional community is very important. And that is what's been happening in the past 7 sessions in this course.
Yeah.
If you notice in the chat box, people are just sharing a lot of information. And I would encourage our co-learners to please keep on asking your questions or sharing your comments. I'll try to read some of them, and maybe our panelists can react or can add or supplement. For example, someone made a comment about in the Philippines, but also in other countries, it still remains fragmented, and there is still a lack of full multi-sectoral involvement. Even the climate action plans are not as well communicated in the communities. Maybe you have some thoughts about communication. How can we communicate climate and health better to our fellow health professionals, but to the general public as well? Any thoughts? Feel free to jump in.
Yeah, as I shared earlier on, that we started off at Khoo Teck Puat Hospital, Alexandra Hospital at that time, was with health promoting hospital first. We actually went from promoting health, where you look at healthy eating, exercise, you know, and looking at personal hygiene and no smoking. And after we've done all those already, then we look around, and it was just very timely. I've got to say, thank God, my life has always been very smooth in that sense, that things just fit in place. And then the next thing progresses went to the environmental and talking about sustainability. And at that time, you know, we're telling people to eat less food. You know, ask them, don't eat so much, you're overweight. But the thing is, then you come in with this, bring your own container, and all the university students are all very happy to bring their own container to save the environment, save the disposables. But that's already considered as a portion control, isn't it? So indirectly, that comes across the point of don't waste food. And also looking at cycling, looking at co-sharing cars or buses, do a bit more walking. We are very lucky because we have a pond in front of our hospital. There's a 1 kilometer radius, and people can run around it as well. And so that becomes another fitness that we have. But I got to say, back to it again, is support from senior management. So even though it's not top down, but there is still that support from the top. Ideally, it's hopefully you'll get appointed, that kind of thing. But the thing is, there's a volunteer indirectly underneath that comes up. So there's a matching of a balance between both support from senior management as well as volunteerism and sort of internalizing such with the staff. We do have staff who are very staunch, and you have to use evidence-based to share with them, you know. Those are the people that we have more challenge with. I have to be the walking Wikipedia to really read a lot and sort of pull things from everywhere and get information in order to actually share out again to different groups. So, you know, like for example, the time, I literally downloaded all the slides and shared individual PowerPoint slides to individual departments to try to nudge them. That's how extensive you have to do that in my own time. It is not, it's volunteer work.
Thank you so much, Gladys. Dr. Kalima, do you have anything to add?
I guess one of the things that we did just the last convention at the PMA, where you spoke about climate change and all of this and its interface with health, was to actually do just that, no? So push others through education And then, of course, we have one health, one global initiative. So the lectures are your lecture actually been streaming for the last several days for those who would like to go online instead of face to face. So still many things to do in that regard. And thank you, Gladys, for saying that, well, many of the things we actually do are already part of mainstream initiatives, no? And we have progressed through the years. Yes.
Yep. Thank you, Dr. Kalimag. And I think what you're saying also is, professional societies must be putting this agenda front and center,
Yeah.
and so for those who are leading societies in your respective countries and communities, maybe in your next convention, your next assembly, dedicate time for your members to learn about and to discuss about climate change and health and what your society can do to address it. Lian, do you have any thoughts about communication? For example, from the Vietnamese example.
Actually, I'm typing to answer the question from the chat box. For communication, I just want to share with the participant one thing. First, before we communicate with people, we have to improve our awareness first. When we have a good awareness and clear what is linked between the climate change and human health, so that you are ready to share with the people. So for the communication, let's think about the easiest way for the people to understand, because some countries like in Vietnam, especially for Hanoi, we have some extreme weather like heat wave or something like that. But it's not easy for people who are not understand about the health sectors, and they can understand the long-term effects of the climate change. So if you find the way, the most simple, the simplest way to convey our message to the community, so it will work. And even for the government agencies in different areas like environments or economic or some other sectors that not in health sector. So try to find the suitable message to convey.
Thank you so much, Lian. And what you're saying is, even within our sector, we need to deepen our awareness. And that's why we have this course. Hopefully, the awareness of the Southeast Asian health workforce is being deepened through this course. We are recording all the sessions. They will be made available in the website of the Global Consortium. So those who couldn't join us synchronously can view the lectures later on. And I'm already getting some suggestions, perhaps for our future courses and other offerings. Maybe next time we can invite companies involved in the manufacturing and supply of medical commodities, as well as government representatives. So certainly that will be heeded, and maybe later on we'll have more panels that will bring much more diverse perspectives. Gladys, do you want to add something?
Yes, I do want to add to say that the other one with engineering, all this is to do with utilities, but we also have to look at procurement. So we really have to work with our procurement department on how to ensure that the specifications are correct, that is of the right angle, so that can nudge the upstream the suppliers to come up with better or more friendly carbon, less carbon impact products. The other thing is to share that I think with human nature, when you talk about really, I don't mince my words, but when you talk about management, it is really competitivity as well. So that's why I like the GGHH, because it's got a platform that can share, and you can indirectly share with other people and say, look here, other people are doing this. What are we doing? So that is an indirect, it sounds not that ideal, not so internalized, but it does get things moving, because there is a benchmark, there is best practices that's already available. So I hope that all of us who are already in the inner circle of sharing, that we share a lot more, because there'll be a lot of other people out there that will want to look and see and be able to look at the results. If they can see that there is results, then they may do something in their own hospital as well. If we're talking about climate change and saving the earth, it's too big a picture. I mean, everybody just think what can they do in their little desktop, in their little department, you know what I mean? Yeah, so I think we need to zoom it down and see what is at the practical level at the hospital and down to the individual departments.
Thank you so much, Gladys. And thanks for emphasizing the role of procurement departments. There was actually one question or comment related to mainstreaming the circular economy concept or approach in terms of managing our the different commodities that we use in healthcare, such as gloves, masks. And I think that this is one area where the procurement, both the procurement departments and the waste management departments can really collaborate on, because they're basically representing the both ends of the entire journey. One is procuring, the other one is disposing. How can we make sure that, you know, we procure less and we dispose less to the environment as well? Any other questions? Let me check. There are more suggestions to have more, you know, again, representative from the Climate Change Commission. By the way, I sit in the National Panel of Technical Experts of the Climate Change Commission of the Philippines, so we can have a separate session on that later on. And then also, someone was emphasizing we need to practice what we preach. We need to walk the talk. And then a lot of people were emphasizing about the importance of education. And again, that is the very reason why we have this course. But we also have to make sure that this eventually becomes embedded in the formal curriculum of health professionals, not just the doctors, not just the nurses, but also dietitians, public health, dentists, pharmacists, so on and so forth. So I think now we're reaching the end of our conversation, which is just the first part of this last session of the course. Maybe I'll just give you a few more minutes to share what perhaps you haven't said yet during this very rich and interactive conversation. Any final tips or reminders to our co-learners to encourage them to not be afraid and to take leadership in climate and health advocacy? Maybe let's start with Lian first.
Wow. Actually, I'm presenting for the public health profession, and it seems that public health profession have a better opportunity to work with diverse stakeholders and work as the different stakeholder, different roles. So in any kinds of role, we try to be ready, be awareness, and equip on the skill for yourself to act and be ready to act. Like the question I was asked by Professor Nga, my boss now, are you ready to act? So then think about the question that my message to the student in this discussion today.
Thank you so much, Lian, for throwing back the question that was asked to you, to our learners in the Zoom platform. And hopefully, like you, they will heed the call and they will follow your footsteps and do something for human and planetary health. How about you, Gladys? Any final reminders?
Don't give up. I think it is already very thankful that everybody that's here is already a buy-in into saving the environment. And may I remind again, share a bit about the book on how we can really relate, reframe, as well as repeat. So you try to relate things to them, and if the weather is so hot, you just say, oh, it's because of carbon footprint, because it's actually the weather, that kind of thing. Then if it's actually talking about reframing, you turn the whole thing around and tell a different story. From that angle, to tell a different story, we need to have that knowledge. That means we really have to be ourselves to go around to sift for information. And I think that is very important as well. Otherwise, we don't know what we're talking about. How can we share properly? And then the other one is to repeat. So continuous repeating to everybody, repeating to management, to all your friends, your colleagues. Sooner or later, they will get it.
Thank you, Gladys. I think that's now the new 3 R's. Remember the old 3 R's: reduce, reuse, recycle. But now it's relate, reframe, and repeat, and repeat, and
Yeah,
repeat,
that's
and
right.
repeat again
That's correct,
until
yeah.
we reach the finish line. Thank you so
we don't
much,
actually
Gladys.
have 3 R's. We have 4 R's because we have a refused at the beginning. So
Correct.
if you refuse it in the first place, then you don't have to do the other 3. Yeah.
Right. That's the newer version. Thank you, Gladys, for all the R's that you've shared with us. And the last word to you, Dr. Kalimag. You're muted.
Let's put another R, refrain,
Relate,
do everything
reframe,
again. Yeah. And well, thanks, Ian, for throwing back the question at us, no? Because in education they say that reflection actually brings forth second loop learning. So so we sit back and then we reflect. So maybe that's another R on what we're doing and how else we can improve on everything else. And of course, again, all of us should do our part, no matter how small, in our different spheres of influence, be an influencer. Yes, I guess that's the last thing I'm going to say.
Thank you so much. And back to me, who's the other R, Renzo.
I was about to say
That's
that.
clever.
I was about to say that. Yeah, you have a friend called Renzo.
Yep. And of course, we also want another R, reform in our sector. But we cannot achieve that without the R's that Gladys mentioned. You also added, Dr. Kalima, very important, reflection. And that is what we are about to do in the last 30 minutes of this course after this conversation. And I also just want to acknowledge, I mean, unfortunately, our 4th panelist couldn't make it, but that meant that I had to moderate an all-women panel. And it's a deep privilege, as always, for me to be outnumbered in these panels with amazing women leaders in climate and health. So, and I noticed someone said in the chat box, another R is revolution. So I think we are now starting a revolution for climate and health, led by, of course, our 3 awesome and bold and pioneering women leaders in climate and health in Southeast Asia. Thank you so much, Dr. Kalimag. Thank you so much, Lian To. Thank you so much, Gladys Wong. And I invite all our co-learners to please give your virtual claps to these 3 amazing women who we should be emulating. Thank you again. And don't leave yet. Don't leave yet, because we have our last session. And you can still stay with us, Dr. Kalimag, Lian, and Gladys. So now our last session is really very simple. We will just be spending the last 24 minutes. This time we'll try to end on time because as you noticed, for the past 7 sessions, we've always exceeded by at least 15 minutes. But maybe this is our chance to meet our expectation or our set or the time period that we set for ourselves, 1.5 hours. But this time, it will be an opportunity for you to be able to share and to speak. Similar to what we did during the first session, when we all asked you to share a bit about your stories. Why are you in this class? Why did you enroll in the Southeast Asia Climate and Health Responder course? So there are 2 things. Number one, I will allow people who would like to actually share their thoughts verbally to unmute themselves and to share again what you want to talk about. But we have to make sure that you will say them as briefly as possible to be able to give more opportunity to others. But also, let's use this opportunity for you to actually state, whether in the chat box or verbally through the microphone, your personal commitment to improving or advancing climate and health in your institution, in your respective countries, and in the rest of Southeast Asia. So that is what we're going to do right now. We can give you a minute or so to think about your answer. What are you reflecting on? As Dr. Kalimag said, it's time to reflect. But also, what is your commitment? What is your pledge? What is your oath? What are you going to do now or from now on to make sure that whatever you learned from this course will continue in your daily practice and in your everyday leadership and advocacy, which is the main theme or topic for this particular session. So anyone who would like to start the ball rolling, and you can choose to speak or write in the chat box, but you have to say something. And I'm sure our time is limited for those who would like to say something verbally. So I hope that the majority will be using the chat box to share their thoughts and express their commitments, their pledges. And what we're going to do is we will be collating all your answers and we will try to summarize them, list them in a document that hopefully everybody will be having access to. So, and I'm already reading the first commitment to be ever made in this class, okay, from Chepo Mokadi. My personal commitment is to continue with the advocacy on climate and health, using environmental health as a strategy to drive change towards sustainability and climate smart healthcare practices. Thank you so much. I'll urge you to be much more specific and concrete. What are you going to do maybe in the next few days or few months or the next year to advance the climate and health agenda in your respective institutions or countries? Anyone who would like to actually share verbally, please feel free to raise your hand. Don't be shy. During the first session, we had lots of raised virtual hands. So this is your last chance to be able to speak, to make sure that your voice is being heard. Okay, we have Christine Kamaing. I'm going to unmute you now.
Hello, yes, Doc Renzo and everyone. So the very practical thing that I'm going to do is to slowly transition to a plant-based diet and be conscious with my purchasing decisions, because I think there's a power or vote to sustainability when I support sustainable brands. Thank you.
Thank you so much, Christine. Now I will call Vanessa. And of course, this session is also open to reflections and feedback about the course. So Vanessa?
Yes, hello, good evening. Sorry for the late response. Anyways, for me, basically, I'm a psych major, so I've seen, and also working at Department of Education, I've seen always the problem in in not also only in our school, but probably all in the community as well, is always the trash. So we did an intervention like for simple things to help lessen the trash inside the school. Like for example, candy wrappers, instead of throwing them in the trash, that student will just put it in their bag so that they can send it to their home so that we can lessen the trash. With this simple practice, it can help reduce waste. The same time, it could also a great impact to reduce floods in our area, which is very prone in our area in nearby Pampanga. So that's one of our, I can say, a good practice to start with. And the same time, go for the greens when it comes to food. As a and the same time, addition to that is that uh, to raise awareness to the youngsters first, so that they can uh, they can be conditioned and make it as a better standard or to sustainability on their practice of having a simple help reducing trash, which is a great one of the greatest problem up to now in the whole world, trash. That's all.
Thank you so much, Vanessa. Thank you so much, Vanessa. Before I call Luz Viminda, I just want to read some commitments made here in the chat box. One said that, you know, his Master of Public Health thesis shall be focused on climate change and its health co-benefits. Thank you very much, John Carlo Timbol. We need more climate and health research, as you've learned from the past several sessions. And there's also another, you know, comment here: buy less things to produce less waste. So again, it speaks to what we earlier discussed about addressing not only the end of the journey of the material, but start from the source, you know, and the point of consumption. Now let's call on Luz Viminda.
Okay. Good evening, everyone. Attending the 8 sessions was an eye-opener, not only for me, but I hope to all the participants in this wonderful course with wonderful and excellent organizers, speakers, and facilitators, of course, Doctor. Now, after hearing all the speakers, we should make a stand and do our share to be a part of making this world a better place to live in. And of course, we should support and encourage people or companies that will create innovations for our future generations. I would encourage everyone to please, this course should not end tonight. It should be carried days after in the years to come. Kudos again to the organizers, excellent speakers, and of course to you, Dr. Facilitator. God bless everyone.
Thank you so much, Luz Viminda. And indeed, it cannot end here. This is just the beginning. And that's why we're asking all of you to express what do you plan to do next. And I just want to read a few more from the chat box before I call Michelle Menez. Christian Sebastian was saying, be more collaborative, taking into consideration indigenous knowledge in addressing climate change. And then there is another one that who made a commitment to take climate issues into discussion in local health boards of local governments, because that is a small step to spark awareness on the effects of climate change to health, where the most vulnerable suffers. Excellent commitment from DOH Tarlac. Can we now have Michelle Andrea, please?
Hi, good evening, and thank you so much to everyone who shared their knowledge, their experience. These past sessions have been eye-opening. My oath and my commitment is to not let my bias, my weakness, my physical location actually deter me from furthering our common goals, which is climate and health. Um, on that note, it's about supporting businesses that do not greenwash. It's about, yes, less consumption of not only bad food, but also plastics. So thank you so much. It has been very inspiring, and it's making me want to change and educate more people.
Thank you so much, Michelle, for those wonderful words. And indeed, there is no barrier that cannot be overcome, even distance, even our location. Thank you for that. And the good thing about being in the digital world, you now have allies from across the country and even across Southeast Asia. So even if you're a doctor or a health professional in an isolated part of the country, you have already a community that can provide you with lots of support. Mirali Dur will unmute you now.
Yes, hello. Can you hear me?
Yes, please. Yeah.
Yes, I'm Mirali Dur, Philippines. I've been teaching climate change since the late 1990s. It was a strange term before, but we should start young. Our elementary, high school, we should teach them more life skills, how to grow their food, how to be resilient, how to have houses that are typhoon resilient. When I was with DSWD, I was 1 month in the Yolanda corridor, no? And there was high death incidence, highly correlated when the LGU or the local government unit officials did not prepare before the typhoon came. But for those who prepared, they were able to evacuate people and really, made sure that their trucks, there was gasoline, etc. But in Tacloban, it was worse because the LGU was inefficient. So the younger generations now, my students, you will face greater challenges aside from the social, political, the poverty, the corruption. You face climate change, and you have to develop the life skills for this, and you have to have community-based efforts, what to do. You have to know where are the high-risk areas. Very few teach climate change community-based. The LGUs, like the barangay levels, they don't really work on this, or prioritize in this, unfortunately. So, and then the food problem, we keep buying, but we need to teach people, families, to have their home gardening, at least start them young. Start with the elementary, your kids at home, include them because they face greater challenges than during our time. Thank you.
Thank you very much, Mirali. And indeed, we need to include the young people as early as now in engaging with this issue. They will be the inheritors of this challenge in a few years' time, in a decade's time. And they are going to be the ones to suffer the consequences, to bear the brunt. And so it's really our responsibility now to make sure that they're involved, they're aware, they're even part of our decisions and actions. So thank you very much, Mirali. Now let's call Mary Bell Lucas.
Yes, good evening. Thank you so much for this course. And my commitment is really, we were already planning to have the farm to hospital. We have a vacant lot, about 3 to 4,000 square meters at the back of our hospital. So it would be a commitment to really push through this program of farm to hospital and to involve everybody in the hospital, the staff, the nurses, to be part of this program. And this enlightened me to be more proactive, and it would be a commitment. Thank you so much.
Thank you so much, Mary Bell. That is very heartening to hear. And I'm sure that the course has provided you with lots of insights from Dr. Lin, the president of the Vegetarian Society of Taiwan, all the way to Gladys Wong, who has led initiatives on plant-forward diets in Singapore. So, please keep us posted. We would love to learn from what you're going to do in your hospital, and Healthcare Without Harm also for sure will be interested to collaborate with you and providing you with support and expertise. Any others who would like to speak verbally? And while I'm waiting for any raised hands, let me just read for a few more written commitments. Okay, one commits to making their 1 provincial and 12 district hospitals green and healthy facilities. And that's in the province of Iloilo. By the way, I have projects in the province of Iloilo. Healthcare Without Harm, of course, has the St. Paul's Hospital as a very proud partner. And it's glad to hear that we want to do that for the entire province. So kudos to you. And again, we are here to support and share our expertise. We have also, another commitment to, let me just read some more commitments, to conduct research again on climate change and health, and also more on farming, and more on awareness raising. And now we have Brandon Ortiguera, who's actually one of my co-learners in St. Luke's, raising his hand. Brandon, the mic is yours.
Hello po, Doc. After this course, actually, I have thought of a 5-point specific commitment for myself that I hopefully can fulfill in the following months or even years. First, to personally lessen the waste that I produce in everyday life. So that's my personal life. Second, to educate myself more and hopefully to spread to others what I have learned regarding the climate health nexus. Third is participate with community efforts or organizational initiatives that advance the climate health advocacy if given the opportunity. Hopefully, I could also join our organization if I get to learn an organization. Fourth, as a medical student, to participate with programs in the college regarding the climate health advocacy. And lastly, to hopefully start a research project learning more about climate change and its connection with health. So I think that's my 5-point commitment that I hopefully fulfill in the coming months or years. Thank you, Doc.
Thank you very much. And we only asked for 1 commitment. You gave us 5. So that is really a hallmark of a very diligent student. Thank you, Brandon. Now we have Chepo Mokadi.
Thank you, Doctor. I hope I'm audible. On my side, I would like to say thank you to the Asian Health for organizing this climate and health responder course. I have already shared my commitment, but I just want to emphasize that I'm also going to share what I have learned from this course with my colleagues and other partners for GGHH Africa. We have a manager, Aziza Rangunwala, whom I will share all this information so that we can implement whatever that has been learned. It can also be implemented in Africa as well. I am talking now on behalf of Africa because what I have earned, what I have learned in this course is not something that you can just get it at any university. This is something that will go a long way as far as just transition is concerned, as far as climate and health is concerned. So my commitment is to share everything that I have learned with the colleagues and associates in Africa. I've already shared my personal commitment to say I'm going to continue with the implementation of IPM, the Integrated Pest Management Strategy, whereby it will assist us, to ensure we reduce the amount of chemicals that we are using in our hospital, reduce the amount of waste that we generate. I have those strategies. I will use all the information that I have gathered through this course, all these 8 sessions. I'm so glad that I was able to attend all the 8 sessions. So it will be interesting to see how the the implementation goes about. My question will be, will we get assistance? Can we get hold of you when we need assistance? Because now I'm committing myself, but I know that I will need assistance in terms of implementation. I hope you are reachable. I hope I will be able to get assistance when I need one. Thank you.
Thank you so much, Chepo. And first, I am very, very thrilled to know that this Southeast Asia course is attended not only by health professionals from our region, but also from Africa, from the Caribbean. I understand we have some colleagues with us from the Caribbean as well in the room. And definitely, and surely this is truly an international challenge. And maybe in the future, we might design a course that will bring different regions together to learn from each other. So thank you, Chepo, for your presence. And regarding assistance support, our three organizations are very reachable online. So if you have specific projects that you require some advice on, feel free to reach us. Also, all the materials of this course will be available on the web page of the Global Consortium on Climate and Health Education, as well as on its YouTube channel. Again, all the lessons, the learnings will be readily made available for not only Southeast Asia, but for the rest of the world. And I remember there's one question, private message that was sent to me. Can you create a green book of the tools, the case studies, so that you have some materials that you can bring to your work? I highly encourage you to visit the website of the Global Consortium on Climate and Health Education and Healthcare Without Harm, because those two are the main repositories of documents, materials, information, videos that can help you deepen further your knowledge, your understanding of climate and health. I'll give the last chance to Emelia Santa Maria, very short, so that we can wrap up the course. Thank you.
Hi, my connection is not so good, but this is just our commitment in the Philippine Toxinology Society, that we will continue to promote the safety of all our rural health workers, such as the farmers and the fishermen, and as well as protecting the habitat, so that we will be able to lower down snake bite cases, which is really a very neglected tropical disease, as well as we would also want to make sure that the habitat of marine animals, such as the box jellyfish, will be identified, so that we will be able to avoid the unnecessary fatalities secondary to box jellyfish. That's all. Thank you.
Thank you so much, Emelia, for that commitment. So there you have it. We've heard from so many co-learners tonight, their commitments, their aspirations, their desires for the future. And we're now getting closer to the end of the course. I'm just so happy that we started 4 weeks ago during session 1 with slightly more than 600 co-learners joining us live. And now we are still at 330, which is more than 50%. So that is still a great turnout. Now I would like to call on our colleague from the Global Consortium on Climate and Health Education and from the University of Utah, Raisa Udin, to give us some final reminders about this course and the next steps. Raisa?
Hello, everyone. Just give me a moment to share my screen, please. All right. So I want to start off by congratulating all of the course organizers, the panelists for today, and Dr. Renzo Ginto, as well as all of you participants who have contributed so much to the course, so much to the discussion. Thank you for that. I just wanted to give you some course reminders. So in the chat box, I have just shared the post-course survey. Please take a few minutes to complete this at your time. We will leave this open for a few days, and we will send this link via email as well to the email that all of you have registered for the course with. And we will let you know what the deadline is to complete the survey by in the email. We highly value your feedback, and we look forward to reading your comments and suggestions as well. Once you have the post survey completed, we are going to take a look at the course attendance. There will be a post-course certificate that will be conferred to those who have attended 6 out of 8 sessions synchronously, as well as to those who've completed both the pre-course and post-course surveys. So those are the 3 main criteria to receive the certificate. One is that you attend 6 out of 8 sessions, one is that you complete the pre-course survey, and one is that you complete the post-course survey. Please give us a few days to verify attendance records and completion of surveys. And once we are able to do that, we will be sending the certificate to all those who qualify via email addresses that you have registered for the course with. Lastly, all of our course resources, including the slide decks and recordings, will be uploaded onto the course website. Please bear with us and have some patience as we continue to finalize our course webpage with all of the resources. And in the meantime, I would like you to be aware that the slide deck for session 4 will not be shared per request from the speaker. Thank you for your understanding about that. Our session recordings, as Dr. Renzo Guinto has mentioned, are also available on the GCCHE YouTube webpage. Additionally, someone in the comment has mentioned that she has left a message in the LinkedIn group. So I would like all of you who weren't aware before that we do have a LinkedIn group established for this course specifically so that we can continue to engage with each other to offer assistance and opportunities. We will add the link to the LinkedIn group in the email as well. Thank you all so much for attending this course and for your participation. I've included the course website in the chat box, and I will post all of these links a few more times as we wrap up. Thank you.
Thank you so much, Riza, for those reminders. And let me just wrap up this course, not just this session, by first extending my deepest gratitude to my collaborators, or our collaborators, the Global Consortium on Climate and Health Education based at Columbia University's Mailman School of Public Health. Thanks to Cecilia Sorensen, who unfortunately couldn't be with us in this session. Of course, to the amazing Raisa Udin. It has been a thrill to be working with you for the past several months, planning this course, designing this course, launching this course, and now you're wrapping it up. And of course, thank you also to our other partner, Healthcare Without Harm Southeast Asia. Their headquarters is actually based in the Philippines. Thank you to Mon San Pascual, the Executive Director, and to Jit Sohal, their Regional Climate Manager, and also to their other colleagues who contributed to this course. And of course, thanks to my amazing team at the Planetary and Global Health Program at the St. Luke's Medical Center College of Medicine. They are the ones who have been assisting in the logistics, some of the designs of the posters and the certificates and the PowerPoints. And of course, they are your actors in your most favorite clinical skills sessions during session 3, 4, and 5. And I'm forever grateful to all their contributions, to their hard work, and to their creative input. And of course, thanks to all of you, to our co-learners from across Southeast Asia, for not just registering and participating in this course, but also finishing this course, especially to those who finished 8 out of 8 sessions, but also to all of you who made commitments to advancing climate and health in your respective communities, your countries, our region, Southeast Asia, and our world entire. So again, thank you and stay safe always. Let's keep in touch. Join the LinkedIn group. Share the course materials to others, the videos, the webpage. And hopefully we'll see you again in a future offering of the Global Consortium, St. Luke's and Healthcare Without Harm, because surely this is not going to be the last. Thank you again, stay safe, and Godspeed.
Thanks, Jens.